Medical disclaimer. The information presented in this channel is for educational purposes only. It is not intended as medical diagnostic or prescribing procedures. Vitamin D and your health. Vitamin D, also referred to as calciferol, is a fat-soluble vitamin that is naturally present in a few foods, added to others, and available as a dietary supplement. Vitamin D is also called the sunshine vitamin, since your skin makes vitamin D when exposed to ultraviolet light from the sun. It is produced endogenously when ultraviolet, UV, rays from sunlight, entering the earth at the right angle, strike the skin and trigger vitamin D synthesis. Vitamin D regulates the expression of hundreds of genes and is integral to biological functions that affect every bodily system. A vitamin D insufficiency or deficiency can trigger several generalized symptoms that you may have associated with other health conditions. There are factors that decrease the amount of vitamin D a person can make from sunlight. First factor: living at high latitudes, particularly during winter months. Studies have shown that people living in the U.S. north of 35 degrees latitude cannot make vitamin D in winter. As an example, that latitude corresponds to any state north of Texas and Georgia, or in Europe from Andalusia, Spain. Living north of 50 degrees latitude, like in Canada, people cannot make any vitamin D from September through March, according to Michael F. Hollick, known for vitamin D research at Boston University Medical Center. Other factors are high levels of air pollution, dense cloud covering, the degree to which clothing covers the skin, use of sunscreen, darker skin types, not sufficient cholesterol in the skin. Vitamin D performs many functions within the body, including maintaining adequate levels of calcium and phosphate, essential for normal bone mineralization. It helps reduce inflammation, which is necessary for the modulation of cell growth and immune function. Vitamin D also affects genes that help regulate cell differentiation and apoptosis. Some foods contain vitamin D in small amounts. Cod liver oil, salmon, wild Alaskan sockeye, mushrooms, exposed to UV light, sardines, eggs. The main indicator of your vitamin D level is 25-hydroxyvitamin D. Data collected from important studies on the subject and the National Health and Nutrition Examination surveys shows a deficiency prevalence of 42% in the U.S. population. However, today, as many as 80% of people may be deficient in vitamin D. It's important to note that how the measurement of insufficiency and deficiency is defined depends on the serum concentrations used. The nanogram per milliliter is used most frequently in the U.S., and the nanomole per liter is the standard for Canada and Europe. Grassroots Health Nutrient Research Institute recommends vitamin D serum concentration levels from 40 to 60 nanogram per milliliter, or 100 to 150 nanomole per liter. At that level, the number of people who are likely deficient in vitamin D would be significantly higher. My professional recommendations, according to my research and practice of many years, the optimal level in adults should be as follows: between 60 and 80 measured in nanogram per milliliter, or between 150 and 200 measured in nanomole per liter. The supplement that I recommend is made from lanolin and should be in a base of coconut oil or extra virgin olive oil only. Avoid any supplement made in a base of any other oil. According to your lab results, you could take from 4,000 international units up to 10,000 to reach and maintain the optimal level all year around. It should be tested every 6 months to a year and modify your intake consequently. If you like the contents offered in this channel, please support the channel by subscribing and also by sharing the channel with friends and family. Thank you.